Hi ladies, and welcome to this week's 2-minute tips. I've been asked a question which is, what is the difference between round ligament pain and SPD pain, which is pubic pain, symphysis pubis dysfunction, feeling like you got pain right in the center of your pubic area. That's what we're talking about. So I'm going to list a few different highlights for each pain so it can help you work out what you may be experiencing. So round ligament pain, you've got this big ligament that holds the uterus in place, and it stretches with pregnancy, and it can often cause a little bit of pain because of the extra stretch and movement on it. So it's usually a pain that is sharp, sudden, stabbing, and feels like a spasm. And it will usually only last for a couple of seconds, at most a couple of minutes. And it's usually associated with a fast or sudden movement. So things like getting up off the couch quickly, or sneezing, or coughing, or rolling in bed fast. And it can often be alleviated by just slowing those movements down. So just slowly rolling over, slowly getting up. Interestingly, it's usually felt on the right, but it can also be felt on the left or just in the lower belly and groin area. And it can improve with gentle stretches or movements, yoga poses, hip flexor stretches, things like that. So that's round ligament pain. Whereas SPD or pubic pain is often associated with movement that is single-legged, asymmetrical, or where your legs are apart. So things like stairs, walking, lunges, getting dressed in the morning when you're standing on one foot, getting out of the car when your legs move apart like that. So it's often associated with that legs apart or legs separated movement. The pain may also feel worse with movement or stretches as opposed to round ligament pain, which may feel better. It will often feel like a sharp and stabby pain right in the center of the pubic bone. It can sometimes radiate down into the inner thighs. And it can sometimes also feel like a bruise. So if you touch the pubic bone, you can actually feel that, oh yes, that's my pain right on that bone down there, as opposed to round ligament pain, which is a little bit harder to touch. And it doesn't often feel like a spasm, whereas round ligament pain will feel more like a spasm. With SPD, it can last much longer. It doesn't necessarily relieve in just a few minutes. It may be something that can last all day in different variations of pain intensity, and you may find that it feels worse by the end of the day when you've been on your feet and you've been mobile and a little bit more active. So you may actually find that you feel worse by the end of the day, and then that can carry over into your sleep at nighttime as well. So always best though with all of these things to go and get checked by your women's health physio just to be sure. We can do many things for both types of pain, particularly for SPD. There's so many different variations of treatment. It's not something to just put up with during pregnancy, particularly if you're noticing your symptoms are getting worse and worse and worse and you're not able to do your usual daily activities. So I hope that helps. I'll see you all next week.